Now we'll go ahead and get started. I want to welcome you to the last of the Reynolds Historical Lectures for 2012 and invite you to the ones coming up in 2013, which will be the big annual lecture in February with Dr. Michael Saad. Go to our website for more particulars on that. It will be on a Friday, I think February 24th. Check the website. Today we're in for a treat because any of you who have had an ear, nose, or throat problem over the past, I understand, 50 years are probably familiar with Dr. Dennis Pappas, who has had a very successful otolaryngology practice here in town for about half century. We're very happy to have him here with us today. He has very much to present to us, and so he told me to make the introduction short, which I will. And I will say thank you, Dr. Pappas, and let's please give him a big hand as he presents the Turkish War of Laryngology from the Dennis G. Pappas Collection. Thank you.
Well, I really need to take this moment publicly to thank, you people on the staff of the library, you and Peggy Balch and Stephanie Ruckus for all, not just for me, but, as I noticed today, even Tim Pentecost and his staff, Jennifer, putting together this auditorium. Little things that every day it takes to get things going. And I want to say that I think Michael was enchanted when I accepted this because I think it saved him 2 trips to the airport. But let's give them a big hand. Really, they do
one thing I forgot to do, and Dr. Pappas wanted me to send this around. We're being treated to some of his instruments. If you've ever gone to his office, it is literally a museum of medicine. And what Dr. Pappas would like you to do would be to take a look at these 2 items and give your educated opinion as to what you think they might be. So
one is easy and the other one is really tough. I had missed it for 5 years, what it was, but I thought it'd be interesting to come up with some guesses about it. The specialty of laryngology, it emerged during a period of, along with 4 other specialties, same time. 5 specialties emerged at a time of medical evolution. That is, new development was occurring in medicine. In other words, the medicine of antiquity was coming to an end, and the medicine, scientific medicine, was just beginning. So, with that in mind, I want to give you a taste of what the medicine of antiquity was, because if that had gone on, I don't know that we would have ever had specialties. But to do that, it's apropos to use the fatal illness of George Washington, because it was right at the end, and 2, he died of a pharyngeal or a laryngeal lesion, an inflammatory lesion. And he died within a period of maybe 48 hours from contacting a common cold. I just want to give you the treatment, just a smattering of this. He was treated with bloodletting, 3 different periods within 24 hours, and it was a total at the end of the period of 100 ounces of blood. 2, he was given 2 blisters at different times. A blister being, well, the use of Spanish fly ground mixed with alcohol, made into a paste, applied to the neck, and it really raised a blister. And the theory of that was counter-irritation. That is, take the blood away from the lesion, bring it to the surface, and get rid of toxins. Then he had two different times orthotic, which was 2 ounces of calomel. Again, counter-irritant, and he also had with one of those an enema. 4, he had an emetic, which was probably Epicac. Same reason, counter-irritant, get rid of fluid, get rid of toxins. He had then a cataplasm that was called, simply what we use today. Ground flaxseed, though, made into a paste, heat, put on the neck to draw heat to the surface. He went on, well, first of all, he could not gargle because of the lesion, but he could speak well during the whole time. In fact, 3 or 4 hours before he died, he was talking. But he got into bed and went on to he went into a coma and went on to his rewards that night. 48 hours. So that was the medicine of antiquity, but it was soon to change. Now, I want to give 2 chain of events of the new medicine that was to come. We'll just go through these and we'll look at these up here, the real McCoys. The new medicine that was to come, and this is Battista Morgagni, and he didn't coin the term, but coming along was a term at that time, pathological anatomy. In other words, he did an autopsy, found a disease, and he applied that information to the physical findings of the patient. And he obviously did this. This was 1761. So he was 79 years old when he published these great books on the seats of disease, which I'm sure is in the, we didn't check it, but I'm sure it's in the Reynolds, got to be. It's greatest books in medicine, maybe. But he termed that he didn't coin the term, but he said, his conclusion was, the seats of disease, that was the name of the book. The conclusion was that a disease starts in the organ. Then 40 years later, this man had a better microscope, obviously, and more precisely he said that disease starts in nervous tissue, mucosal tissue, muscular tissue. That, you had already one basic science, pathological anatomy. He was a pathological anatomist. Now you got another one, histology. So you're getting the basic sciences as time is going along. All right, then you go back now to 1761, the same year of Morgagni, and this man wrote a little booklet, and he was Leopold Eulenbrugger of Vienna, pathological anatomist, and he described percussion. Percussion, a lost art. You tapped and on the chest especially, and differentiated normal from abnormal. Well, he claimed, well, first of all, he went to the autopsy room, tap, 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 to get the sound. Then he injected the lungs with fluid and tapped again, and he used that information clinically and came up with ways of diagnosing especially chest diseases. He said that he thought of that technique from when he was a child. His father was an innkeeper. He helped them in the inn, and they would tap the kegs to get the level of the brew. And so he applies that. That went unnoticed. I mean, 50 years, nobody knew that. Until this man, Corvisart, this man Corvisart of Paris, an anatomist, a pathological anatomist that wanted something to apply clinically. He was finding these lesions, and he describes or differentiates pulmonary from cardiac diseases, which couldn't be done He first to describe carditis, first to describe congestive heart failure. But he wanted a sign, he wanted a physical something that he could do to diagnose. And he was told of Warren Bruegger's book, and he finally translated it. And he started using percussion. Same chain of event now. All this is one chain of event. This is the last of the chain of event, and that's Renee Laennec, who was born of a tuberculous mother. She died soon after he was born, but later there was a reason for his interest in pulmonary diseases, and he said he had this patient. She was a young patient, but this is an artist's conception of that young patient because he said she was stout. And he said percussion. He employed percussion. He learned it from his teacher, Corvison. He said it was out of the question because the teacher was too thick. And then he said it was also out of the question that I put my ear up against her chest to listen to her heart sounds because he said she was too young and that it would have been embarrassing. So he rolled a wire of paper and listened, and lo and behold, it was louder than anything he had ever heard. And he says, well, you know, I heard the language of pathology with that. And then he describes how he came to this idea. He said he was watching children play on the playground next to the hospital. There was a big hollow log, and they would whisper at one end and hear it loudly at the other. This was a monumental find because not only Laennec did he discover this instrument. Now there were two ways of doing a physical examination, or two methods for it, but he did something else. He differentiated all the diseases of the pulmonary system, and he could tell from percussion and auscultation the difference between pleurisy and pneumonia. And you go down the line, and then physicians, his successors, had all this information. So it turns out that the crowning glory then of physical diagnosis was this man and those two instruments. Next. Now, that was a chain of events, and there were hundreds of these. We could spend the rest of the day and night going through chain of events that changed medicine at that time. But I just want to mention Müller. This is Johannes Müller. I mentioned him because of basic sciences. He was considered to be the greatest physiologist of all time and established that as a basic science. But he or his pupils then established most of the other basic sciences. At the age of 19, Johannes Müller wrote his dissertation on the respiration of the fetus. And of course, embryological findings had been coming along during those centuries. But he then establishes it as a basic science. And you may have heard of the Mullerian ducts in embryology, named after Müller, Mullerian ducts. There are a few features that I want to mention about this with the chain of events, the framework of how he did things. One, anything that was done in his laboratory had to be on a scientific basis, based on chemistry, physics, or structural anatomy. Two, that each physician had to have his own laboratory. And the lining of German medicine for the rest of that century was the laboratory. And the German doctor typically saw patients till 4 o'clock in the afternoon, then went to his laboratory and spent time experimenting. And then three, he had jewels as pupils. Every one of his pupils made a great discovery. Typically, I wouldn't say every one, but most. And here I'm going to just mention one. That's Helmholtz. They say Helmholtz may have Hermann Helmholtz may have been a greater physiologist than was Mueller. Whereas Mueller said, no one will ever measure the speed of an impulse through a nerve. Helmholtz, though, did it through the auspices of mathematics and physics. And his figures that he came up with are used today. They were so accurate. Here it shows him, and he is the inventor of the ophthalmoscope. Did it inadvertently. Another story, but we'll go on. And this is the way that network of everything that was going on. And I didn't tell you that. I should have told you this at the beginning. Think of the years 1800 to 1850. There's overlapping. That's when all this was going on. All these changes. Jacob Henle, the first pupil of Johannes Mueller, considered to be the greatest anatomist since Vesalius. Now, we're going to get into our specialty of laryngology, and here's one of the men that was involved with that discovery. Ludwig Turk was born in Vienna and not the country of Turkey. He was obviously well thought of at the University of Vienna, so they sent him to Paris and to work with a Francois Maginde, who was the greatest experimental physiologist of France. And he spent a year there, then went back to Vienna, and his first work was on an anesthetized dog. He severed the spinal cord and found that there was a distal atrophy of the spinal cord from the incision. He reported that to the medical society only to find out that Walla had described it 2 weeks before, and his work went unnoticed. The next year, he did another anesthetized dog. He made a lesion and found on the same side of the lesion there was paralysis, and on the opposite side there was numbness. He reported that to the medical society only to find out that Brown-Sequard had described it months before. Again, he got no credit for that. But Ludwig Turk is well known in experimental neurology. He named 3 tracts of the brain, and he worked out the cutaneous distribution of the nerves from the spinal column. Next. We're going to skip that and come back to that. The next man I want to give a short sketch on is Johannes Nepomuk Zermak. He was from Prague and not from the country of Turkey. He was considered a physiologist, a diagnostician maybe too, but he was very closely related to, in his work, he was closely related to Jan Purkinje, who was one of the first students of Mueller. And all 3 were interested in the physics of phonation. So they had this going on. He was better known, though Zermak was better known for his work on the vagus nerve, and he was the one that discovered that if you put your finger and press hard on the vagus nerve in the neck and the anterior triangle, that you get a slowing of the heart. Let's go back to the nerves. Now, we're going to go to about 1857. And for some reason, Turk, obviously things were going on with specialties. You know, Turk was, the only thing left then was the specialty of laryngology. I guess he was fiddling around. And he made some mirrors. He made them himself. It wasn't these, and these are about 10 years after that. But he made a couple of mirrors that looked something like this. And he was looking at the larynx with direct sunlight on his patients. And that doesn't work out, I can tell you that. He must have gotten frustrated with that. But he said that he had to put it away because winter was coming and the sun wasn't, the rays weren't as strong as in Vienna, and then he said he was going to come back to it in the spring. So he had them on his desk, and Zermatt happened to visit with him and saw the mirrors on the desk and asked him if he could borrow one. And Turk probably figured he was working on physics of phonation, so he let him have one. Well, that was, say, January of 1858. 3 months later, Zermatt gave a presentation to the Vienna Medical Society on auto-examination of the larynx using artificial illumination. He did something there. And a small mirror. I mean, you can imagine that irked Turk. And he obviously, and somebody writing at that time, I thought it was amusing, is that they said that, you know, if he could examine his own larynx, he had to have a big mouth, small tonsils, and a retracted uvula, because it is not easy to do. But Turk, then this was in March of 58. In April of 58, in a week later, a week after he gave his paper, Turk went to that same meeting. It was a weekly meeting. And he got up and he said, look, he said, that priority is mine. He says, that guy's a scoundrel. He said, you know, that was my idea, that was my mirror. Well, the next week, then Zermatt gets up and he said, well, there is a question about priority. And there is the situation of that mirror. He mentioned it at that meeting, and he wrote many, many articles after that. He never mentioned that again. That was it. But he also said at that same meeting, while he was still on his feet, he said, Herr Turk simply always comes too late, referring back to those missed accreditations of that work that he had done. Well, boy, that really got under Turk's skin. He was provoked and but he then, the following, this would have been in March, and in April, then Turk gave a paper on the use of the laryngoscope. And it was right about at that meeting that this was going back and forth, and then there's the ensuing papers, presentations, and books that were written by each, that the people at these meeting, the physicians, coined the term the War of the Turks. And that's what it became known as. Then Turk did give the next presentation, and that would have been still 58. It was April of 58. And then in 59, at the beginning of 59, Zermatt gave a presentation on 7 laryngeal diseases using the laryngoscope. And later that same year, that would have been 59, Turk gave the same subject, 7 cases. And of course, Zermatt is saying, well, Herr Turk always comes too late, simply comes too late. Then it was the beginning of 1860 that let's see, we'll go forward. I think it's this book. This book, yeah, the title page of this book. It was 1860, he wrote this booklet on the laryngoscope. And then later that year, at the end of that year, I think we have that other one title page. Turk, no, that one's still Zermatt. Turk, yeah, 1860. Turk wrote a similar booklet, of course, coming late again. And then these two books were translated into English and French. Of course, Zermatt's book first, and then Turk's book, because Turk was always late with it. Now, Zermatt was very inventive and resourceful. He was outgoing, he was communicative, he was witty, he was just a good personality, whereas the Turk may have been an introvert and the opposite. But at any rate, inventive, resourceful. He did three things that forged him ahead. Whereas you put the mirror in to look, and you look down, the angle of the mirror is down, he turned it the other way, devised a little retractor, could see the vault of the nose, got the credit for the specialty of rhinology. 2, he went around the great cities of Europe and set up clinics. He propagated the specialty. In fact, the greatest laryngologist of all time was considered to be Morrell Mackenzie of London. And Morrell Mackenzie was so good, they say he could put a mirror in, he devised an instrument to clip a polyp, put the instrument down, just like that, have it out without anesthesia, within seconds. He had the manipulation, his hands were just wonderful. But he was trained by Zermatt. You know, and all these guys trained by Zermatt, they thought he was the guy. Then, 3, Zermatt developed photography of the larynx. And in fact, he got credit for being the first man to photograph an internal organ. And the first 3 photographs of the larynx are in a museum in Vienna. Now, the propagation of all this feud, the disbursement of this feud was going about. And it was going about by students primarily from different countries coming to Vienna. They were taking courses. And of course, it was the talk of the town, the War of the Turks. Then they'd go back to their respective countries, and at the medical meetings, it was the talk of the medical meetings in every country. Secondly, both of these men had pupils. Mainly, Turk had his pupils right in Vienna, whereas Zermatt all over the world. There was friction among them as to who did this first. The Turks, this was interesting because Turk had 3 immediate pupils, and one sided with Zermatt. He was a close friend of Zermatt, was the reason. And of course, he didn't last in that clinic very long. Then the universities, you know, it was a feather in the cap of a university to have that institution, you know, laryngology started here. And I ran across an article translated, and it was from the University of Pest, Budapest. And Zermatt had been a professor there for 2 years. But obviously the rector it must have been the rector, I'm not sure about that, but translated it says, the truth about the priority of the laryngoscope. So, you know, they wanted this credit for that. Then the court systems were involved with all of this. Obviously that Zermatt, you know, brought a suit against, the Turk brought a suit against Zermatt. Well, the War of the Turks ended after about 3 years. And it ended when the Academy of Sciences in Paris decided to honor laryngology. They obviously had the wisdom of Solomon, because they said it's a split decision. He says to Turk goes the credit for the starting of the specialty of laryngology, but to Zermatt goes the credit of the use of the first laryngoscope, the first illuminator, and the first pioneer of the specialty. But the War of the Turks did something to laryngology. It made it the fastest growing specialty of that group of 5 from that era. In no time it became, and 200 books on laryngology were written during that period of time. The Turk, obviously, I made it look like he was inactive, but what he did, he went back to the basics. He went to the autopsy room while Zermatt was doing this globe-trotting, and he worked out pathological anatomy, the lesion of the larynx and what the symptoms are, and then he wrote his magnus opum, you would call it, on another one. No, we're going the wrong way. In '66, this is the, and this book was the opus magnum. The students used this for generations to come. To be complete with this, I want to interject. Go on to the next. I want to interject something, because the English wanted to, they said that someone from London was the first laryngoscopist, and it was a singing meister. Emmanuel Garcia was he taught singing lessons in London. He was taking a vacation in Paris, and a glare from windows at one of the courts, he bought a dental mirror that looked something like this, and he was able with another mirror, and he was a singing master, so he could control his pharyngeal muscles. He saw his vocal cords. We know he saw them because he reported it in 1855, 3 years before all of this went on. And the English really made a big issue of this, that their man was the man, real man that did it. And they gave him 100-year celebration. Well, he lived to be 103. At his 100th birthday, they gave him a big celebration about this. And he got up and he said, I don't know. He said, why? The big fuss. He said, I only paid 6 francs for that Spiegel. Spiegel being the German for mirror. But yes, the English give him the credit for this. Now, so much for that. I really wanted to save some time for the roadmap, what I call roadmap. Now, in this collection, there's 2 ways of collecting books. One is, there's old and rare books. One is to buy anything and everything that comes along, because you may not ever see it again. But the other way that we're trying to do this is what I call, you get the books of the specialty, which we have. You saw them. You saw the title pages. Then there are roadmap books that lead up to that. And anatomy would be one of the roadmap books from the Renaissance. You see, all of the anatomy was pretty much worked out in the Renaissance, and the most beautiful books come from the Renaissance period. And the most beautiful book of otolaryngology is this book, Casario's book from the Renaissance. Casario, to just give you a little background, was a very poor man that went to Padua to find work, and he, well, let me say that in line of succession at Padua, there was Vesalius, there was Fallopius, and there was Fabricius, and then there was Casario. 4. Well, Casario went to Padua. He got work as a valet to Fabricius, who was very well-to-do. And Fabricius says, you know, you help me with the autopsies. He did that. he was so good, he said, you just do all the autopsies. And then he started helping him with writing his lectures, and then before long, he said, and then before long he was giving the lectures, and during this course of time, during this course of time, he was going to the university, got a degree. And when it came time for someone to succeed Fabricius, they picked Caserio. I'm indebted to Ted Gimmelin. Ted Gimmelin gave me a publication. There was friction between, I didn't know that, and it changed my story. I didn't want to hear that. But, yeah, Ted, yeah, there was friction because...
Ted is our rare book catalog.
Ted is our rare book catalog. He's not here today. He had another engagement. But at any rate, there was friction because of the student, the student became more famous, was becoming more famous, I guess, than the master. But what makes the books of the Renaissance beautiful is that one, they had artists to do the artwork, and the anatomy is drawn by, I mean, they're artists, they're not amateurs. But there's a lot of symbolism in books. If you look at, this is Caserio, the two Cupids. To the Renaissance people, that was a dualism in nature, night, day, man, woman, moon, sun, so forth. But you go through all that and you can figure out what it all meant. And then the artist did all, this is another title page. This is all the animals, he was a comparative anatomist. All the animals, and he's telling you, look, I dissected all of that. And in here is what I learned from that. See, he's telling you what's in the book. And it's symbolism, typical. But this book, Caserio's work, was considered the most accurate of the Renaissance. And his predecessor, his successor, used several of the plates for his own body. Another book here again is a roadmap book. You know, what leads up, you know, significant to that specialty, anatomy, physiology, etc. This book, though, is more for rhinology, but an important work, and I'm really proud of this one because I've never seen it. And I didn't know what I was buying at the time. But it turned out to be a gem. But at any rate, there was a dogma that mucus was formed in that went along with my and mucus was formed in the skull, in the brain, and it got to the nose and the rest of the body where it was secreted. It got there somehow. And the great Thomas Willis, the great neuroanatomist, says it goes through the nerves that leave the brain, and that's how it's secreted. But this guy, Snyder, Conrad Snyder, he was a student of, or he knew of Bichet's work. And he went to the autopsy room, examined skulls, found no mucus in the closed system of the skull, then examined the nose and found beads of mucus on the middle and posterior membranes of the nose, and he concluded he got rid of that dogma that went on, that mucus was not formed in the brain. So that's an important, really, document, I think. Here, now, just throw this in, not that it was that greatly important, but Johannes Müller, on his work on the physics of phonation. But Johannes Müller, it may be that he did anything and everything. He did so much. Next, I think is it, isn't it?
Yep.
Yeah. There is a book that is that I would call roadmap book for the operating chief of staff, and that's a book that the specialty has been done, and somebody does detailed anatomy on that subject, and then the surgeon can take it into the operating room and use it as a cookbook. Now, it's been done for rhinology, and it was, I had him a picture of him, but I said it wasn't that important. Zucker Candle, the great anatomist of Vienna, did it for rhinology. His teacher, Joseph Hertel, did it for otology, and then I couldn't find, I asked a colleague about 2 weeks ago who did it for laryngology, and he said, and we don't have it. We don't have Zucker Candle's book, and the one for, those are two we got and we need to look for. But Lushka's 1873 book on anatomy, the edition, it was a, he had many editions, but that specific edition then was the operating joint chief book for laryngology, the larynx. Now, in conclusion, I don't want you going away from here thinking that medicine was just not very bright for 22 centuries. And it went along, and like the fiscal cliff that they talk about today, that it just, and here it was, and you know, doctors, all physicians. If you go back to beginning of time and go back to the great Greek philosophers, and they said, look, we're taking medicine away from the priest. We're going to make it scientific. 400 years later, Hippocrates said, I'm going to take it away from the philosophers and make it scientific. He says it's diagnosis and physis. Physis being help the body heal itself. But don't forget, Hippocrates was a philosopher too. And then if you, all those years, these great doctors, and you got the names of on those circulars, all, you know, around the page, I think about that. They all tried to make medicine scientific. But they didn't have the tool. Hippocrates, those guys, they didn't have the tool to do that, and it always was associated later on with dogmas, that thing with the mucus. Medicine was full of, you know, these doctors were really philosophers too, you know, all those centuries. But then the tool came, and we've mentioned it. And we mentioned Morgagni. The tool was the microscope. And when the microscope was invented, Morgagni was probably a baby. He used the microscope, but he said it was the organ. He couldn't see, with his microscope, it wasn't strong enough. He couldn't see. And he said it's the organ. But then Bichet saw it better, but not all the way. Tissue, he said. But then Mueller, and he had Theodore, the guy with the cell, Theodore Schwann, the structure of the cell. You know, the cell has not only is it a cell, but it has these other things. And then Purkinje comes along and says there's protoplasm in the cell. You know, that's stronger microscopes. 1830 was the strongest microscope, as good as today. It was achromatic lens put into it. It removed all aberrations, 1830. So, and then Virchow, another student of Mueller, says, you know, he says, man comes from a cell. He elaborated, because Mueller said it. He was the, he said it first. It was cancer, he said, comes from a cell, one cell. But then Virchow enumerated on it and says, yeah, they said, you know, man comes from a cell, plant comes from a cell, and he said disease comes from a cell. And so, you know, that was the basis, and medicine was getting all those basic sciences. Now, a word briefly about the specialties. The specialties, of course, came on at that time, but the specialties were a product more of technology. And not only technology, but it was a product of the employment of technology. That is a doctor operating on the external surface of the eye and everything on the body for him to sit down and look at a larynx where he had to have an illuminator, a mirror, and then his reflector was first in his mouth. They bit on it. That didn't work. They put it on the glasses. That didn't work. Then they put it, remember the head mirror, and all that you know, was being done as employment of technology, I think. And it took one doctor sitting there just manipulating that equipment to do it, and to do it well and develop the manual dexterity to do it. So with that, I will try to answer any questions. Oh, the two items, I'd like to know your opinion. Who has the answer to the necklace?
Tuberculosis.
Huh?
Tuberculosis.
Right, you got that. Typically, tuberculosis was the reason, but I think this is celluloid. Celluloid would have been come into existence 1870. The colors of it, a little bit Art Deco, so I'd say it was in the 1920s for tuberculosis. You know, people like to kiss babies back in those days. And so to try to hold down the contagion. Now this one is tough. I'll have to tell you, I had this 5 years. It was sold to me as a tongue blade, but it wasn't a tongue blade, I knew that. Back, the first sign, physical examination sign was percussion. You know, they tap. This is called a pleximeter. They put this metal down and tap on it, and it was the sound that they got. They thought it was a little sharp pleximeter. A value, unusual, and I can date it because it's sterling silver. The English did that in the early 1800s. Yeah. But yeah, this one is a rare piece. Now I have what we had on slides. I have the real artifacts here. Those that are interested to come up with. Do you have a question? All right, this is a bleeding bowl and probably a barber's bowl, more so than a physician's bowl. But barber surgeons did a lot of the bleeding back for centuries. And you know, I told you that George Washington had blisters, and they used a chemical blister, which was a caustic, which was the Spanish fly ground up. But it can be done with these little bowls, of course, suctioning cups, they call it. You can raise a blister with that by using the heat lamp, which is next to it at the top on the left. And those are bleeding for bloodletting. The most common instrument in medicine of antiquity is because it was done for 22 centuries, bloodletting. So there are a lot of those available. I used to find those all the time at the flea markets here in Birmingham, and people thought they were letter openers. And so I picked up jillions and jillions of those. Now this is a mechanical blade that was common in George Washington's time. And this is the case that it came in, and the bleeding bowl. An enema set, which here again, that was a common form of treatment that they even gave George Washington back into to take the toxins out, to counter irritant, take the swelling away from the original lesion. By the way, George Washington, I don't know that I said, George Washington's lesion was an acute inflammatory lesion of the larynx or pharynx. He could gargle, he couldn't gargle, but he could speak. So I would think it was high, right? It was high up in the throat, it had to be. So it was probably a peritonsillar abscess, but he died of a pneumonia, I think. But it was probably a peritonsillar abscess. There was no examination with the medicine of antiquity. There was no examination. They didn't need to do an examination. The treatment was the same. So you know, if you consider what was available in the way of instruments, tongue blades were, but there's no report of all that's been written about George Washington that they even looked at his throat. But here's a tongue blade made of ivory, and these are not company made, those were handmade back in those days. And this was made of whalebone. And then there's what you would call a magnifying glass, but the doctor of antiquity called it a microscope. And he did look at, say, something on the skin with that. But typically the physical examination that doctor did was to just look at the patient and feel of his skin. And as you noticed from that first slide of the doctor with George Washington in his deathbed, they were feeling his pulse, not for the number of pulses per minute, but for the strength of the pulse, because they knew if it was strong, they'd have to bleed him more. You see, weakened that pulse. A strong pulse indicated bleeding. Yeah. Go. I think we got one more, haven't we? No, that was it. Well, I thank you for your attention.